Much, Shelby, and yeah, thanks for having me on. Thanks for joining in here, everyone. Yeah, so like Shelby mentioned, I'll give sort of a brief overview of me and our company and sort of where we're at with healthcare, and then I'll sort of explain what the chamber has going on with the SOCA benefit plan. As she mentioned, it's a small group. If I'm saying something that's confusing, if you have questions, feel free to stop me. Everyone's on probably a different level of understanding of how the plans work and all that. So I'll try to give a high level overview of it. I'll also try to respect your time. I can get a little wordy and talkative, so I'm going to jump into it right now so this doesn't take too long. So here's the agenda. Again, give you background on myself, overview of the health insurance market going into 2023, and an overview of the SOCA benefit plan, and then I will open it up for questions. I'm Michael Dugan. The other owner of the company is Brian, who's my dad. We were started by my grandfather in this building in 1975. We've been in the same building since. We're on Water Street, sort of behind the courthouse, next to, if you know where the old brewery was, we're just to the east of that. We're health insurance agents, and I highlighted that, which looks aggressive now that I'm reading it, but we don't do any other kind of insurance. There's a ton of great insurance agents in Troy. I know most of them. I do business with a lot of them. We stay in our lane, which is health insurance. It's a very not confusing to us because it's all we do, but it changes all the time. I've found if you spread yourself too thin, you can get behind. We've grown into one of the largest brokers, or the largest in Miami County because of that. We have a very high retention rate. But if there is an insurance agent on this call, or if you know an insurance agent, we partner with a ton of them. Most large brokerages that do health insurance, they do both. So they'll have a division for health, division for property and casualty, investments, and all that. We're good at health insurance. That's all we do. Brian, again, my dad, he tends to work with more large groups. This isn't completely segmented, but most of the large groups Brian works with, and then I'm the small group broker, which is why I'm on this call. We do crossover. I've got some large groups. He has some small ones. In the health insurance world, that employee counts 50. So if you have less than 50 employees, you're considered a small group. More, you're considered large group. We also have an individual and family agent, Lindsay Brown. She does a great job. That's the Affordable Care Act stuff and some other things I'll kind of mention. And then we have a Medicare broker, Randy Peters. He's been working with us for over 20 years. He used to work for Summit Insurance Agent or Summit Insurance Company for people who have been around the area for a long time. He was an executive there. He's been with us for a long time. And then we also do compliance. That's another thing I think sets us apart. When the Affordable Care Act came along, they put a ton of new regulations on the book. They also started enforcing a ton of regulations that had been on the books for years and years, and they started auditing companies. Our clients, not mostly, but our clients included, which sort of brought up a whole line of us hiring a full-time compliance director. So we provide all the documents for no cost: 1095 forms, ERISA wrap documents, Section 125, premium only plans. We're the only brokerage agency I know of that provides those at 100%, no cost to our clients. So that's a little bit about us. There we go. So we thought this was a good time to have a health insurance meeting because of the time of year and what's going on in the market. So we're in fourth quarter. Most companies right now have either received the rate increase or will get it in the next few weeks. All of our clients have received it. We usually get them around October 1st. And then that's when we start the shopping process for 2023, the upcoming year. Health insurance, most of my clients say that it's their second largest expense behind payroll, and it's getting more expensive every year over year. I've been doing this for about 15 years. I worked for Anthem Blue Cross and Blue Shield before I joined this agency in 2011. So for my 15 years of doing this, it's been the same story every year, rate increase after rate increase. That is literally all I do all day, is deliver rate increases to my clients. It's a crisis with healthcare. We have a great system. I mean, the healthcare system in the United States by any metric, outcome wise, waiting period wise, doctor accessibility wise, everything about it's fantastic except the cost, and it's getting worse. This year's no different. So the average increase year over year since I've been doing this has been about 10 to 12%. This year it's about 15%. It's hard to come up with an average because it is all over the board. Honestly, everything lower than about single digits is good, which is kind of a joke. I mean, I joke around with my clients, which is not funny, so I should probably stop joking about it, but everyone's complaining about the inflation we're seeing in the last year and a half. It's been that story with healthcare year over year since I've been doing this, so the increase this year was a little higher because of those things have trickled into the healthcare market, but it's on top of an already increasing segment of year over year increase. So the reason for the cost, it's the hospital expenses. I'll be honest, the key catchphrase in the medical industry is trend, and that's just medical inflation. So every year we get these rate increases. Sometimes it is because, there's high utilization or high predictive risk. But even if it's not, if a group's running great, maybe they're self-funded, so I can see their claims, I can see that they're very healthy, they should get a decent increase, and they still end up with a 6 or 7, 8, 10% increase. The insurance company always uses the term trend, and that just means medical inflation. So that says if you get a knee surgery, colonoscopy, whatever it is, you get that done now, and then you get it done in a year from now. It's the exact same doctor, same facility, same medications they give you, same x-ray, everything's the exact same. It's going to be 10 to 12% more expensive. So that just bleeds right into the health insurance cost. So the bottom line is the private employers, like I'm guessing a lot of people on the call, all of my clients, they're the ones funding these hospitals and the medical bills. Again, we have great hospital systems, especially here in Troy, just very expensive. So that's really the main reason for the increase. And that's all I'll say on that. I know I said I'd respect your time. There's a lot that I have to say about that, and I'll avoid doing that for your sake. Yep. And then possible solutions. So there are some exciting things, and that's where I'm hopeful in my lifetime of doing this. I mean, I'm 37. I hope to do this another 30 years or so. I'm hopeful I see it start to go in the other direction. And there are some things I've seen recently in the last few years that I think could sort of nudge that. That's all we need is a trend in the other direction. Nothing that legislation does. These new, every political cycle, people come out with these new ideas. It's not going to drop in half overnight. But if we can just get the increase to stop and then start going the other direction, it would be awesome. For large groups, there are some very neat things that I think will catch on eventually. The big ones are reference-based pricing. If you have more than 50 employees and you're self-funded, you can get a reference-based pricing network, which reimburses hospitals based on Medicare's reimbursements. That's a great thing that, again, it hasn't caught on as much as I would thought. It's been around for 5 years and it hasn't caught on as much as I've thought, but I'm hopeful it is in the future. The individual market, the subsidies have increased quite a bit this year. The other big thing that we do a lot of, and that can be a great situation or a great plan for certain situations, are the Christian ministry sharing plans. If you know someone who's relatively healthy, they need a plan for just themselves, they're not getting it through an employer, that's a great option for those people. So that's a kind of a newer trend. Since Affordable Care Act, that's sort of newer. And then the big thing with small groups I'll go over right now, they're called MEWA plans. So the plan available through the chamber is through Anthem Blue Cross and Blue Shield. It's called the SOCA benefit plan. What that stands for is Southern Ohio Chamber Alliance benefit plan. And it's considered a MEWA, which is a multiple employer welfare arrangement. So the way it works is Anthem, if you sign up for a plan through SOCA, on the back end, they pool you with other small companies, again, less than 50 employees. And there's a couple reasons, a couple ways that can help the premiums, and a couple reasons for doing that. One is you're spreading the risk around. With insurance, that's usually a good thing. Now, I will preface it with saying that's a little overrated in health insurance. I mean, people all the time think that the larger the pool, the better. I'll be honest. We've got clients from 2 employees up to about 2,000. Our largest client, around 2,000 employees, has the highest rates. We've got some smaller groups that are paying in the $200 range per employee. That largest client of ours is closer to 1,000 per employee. So it's really not as much about the amount of employees in a pool as it is the health of the employees. So that's the other big thing that the SOCA benefit plan does, is it lets you medically underwrite the plan. So when the Affordable Care Act came out and really implemented around 2014, they tried to put together the individual in the small group market. So if you had less than 50 employees, or if you bought a plan on your own, you had to go into what's called community rating. So there's no medical questions. The price is based on where you live, how old your employees are. With a plan like the SOCA benefit plan, which again is a multiple employer welfare arrangement, they are able to file with the state of Ohio as a large group. And that allows them to medically underwrite the plans, which is great for most companies. When a lot of people hear medical underwriting, they think you have to be perfectly healthy. It's only for the healthy groups, but that's not always the case. I've found, especially this year, and as more competitors have got into the market, Anthem, it's a very profitable block of business for Anthem. So they're trying to expand it, and they've gotten a lot less strict on their underwriters. So it used to be when this first rolled out in 2016, it was a pretty strict underwriting cutoff, where about half the groups we sent in there got declined for quotes. The other half benefited greatly from being in the pool. It's probably more about 80% now. So about 80% of the groups get a better quote than what's available through those community rated plans. So again, it's on the back end. If you signed up for the plan, you go through a quote process, which I'll explain at the end. You would get Anthem quotes. On the back end, they're pulling it together. You would get a bill from Anthem just like you have a normal Anthem plan. You would never know, your employees would never know. On the back end, you're being pulled together with other companies. So yep, it's cost saving solution. Small businesses, you may be looking for a cost saving benefit solution. The SOCA benefit plan is a self-funded multiple employer welfare arrangement offered by the Southern Ohio Chamber of Commerce. Southern Ohio Chamber Alliance with Anthem Blue Cross and Blue Shield. The plan offers a way to share an overall claims risk with eligible businesses and other small employers, fixed predictable rates, financial protection, lower cost alternatives to traditional healthcare. On the Affordable Care Act, saving 20 to 25% on your monthly medical spend. I'll be honest, if you're comparing that to the Affordable Care Act small group plans, it's more like 50%. I mean, it's for a relatively healthy group. It is significantly less than what's available for ACA plans. Eligibility requirements. So you have to have less than 50 employees, and then you have to be a member of one of these participating chamber alliances. It started out as just this first one, Southern Ohio Chamber Alliance. It's expanded into all of these other ones. So I'm assuming that everyone on this call is a member of the Troy Chamber, which allows you to be eligible for the plan. And then it uses Anthem's network. So again, employees would get an Anthem card. They would use the Blue Access PPO, which is the best network nationwide. All of the stats on here are accurate. It's about, says 95% doctors. In Ohio, it's probably even higher. All the hospital systems, Premier, Kettering, every other system I've ever come across in Ohio accepts this plan. So here's some facts about it. It started in 2016. There's currently 95,000 members in the plan. That's 95,000 employees of small businesses throughout the state of Ohio, which that number is just exploding every year. The average increase is about 9%, which again is less than the industry trend. Renewal persistency is about 95%, which is good. It means they're renewing well. That's one thing I've found with this block of businesses. If you're relatively healthy enough to get into it, it's almost, you'll be in it for a while because it renews better than most plans I've seen. And then this is a big one too, especially recently. It includes a built-in wellness plan. So that's been a huge thing recently with employers. Hiring has been extremely hard. So companies, for the first time since I've been doing this, companies are trying to find ways to increase their benefits. For the longest time, it was increased deductible, lower contribution percentages, reducing benefits year over year. This year, it's kind of gone the other way, and wellness is a big part of it. These Anthem plans, if you sign up for a SOCA plan, they all include a free wellness initiative that's better than the ones we sell. We sell some standalone company, some companies that sell these standalone plans. And this honestly is more robust. So if you're an employee on one of these plans, you download the Anthem, it's called the Sydney app. And then you just set up your profile and you start earning rewards for weight loss goals, getting your checkup and physical. You can link your smartwatch to it, and you earn up to $200 per year per employee per person on the plan. So I actually, my company, Benefits Analysis, has been on this SOCA benefit plan for about 2.5, 3 years. I just set this up because they just rolled this out. I believe it was in May of 21. And I set it up, and within like 10 minutes, I had like $85 that they give it to you in gift cards, and it linked up with my, I don't know if this was a glitch in the system, so I don't want to overpromise on this, but I linked it up with my Apple Watch, and it went retroactive to the beginning of the year. So it gave me credit for like 50,000 steps or more. So I ended up with $85 in my account within like 10 minutes. So it's very easy to take advantage of, and very user-friendly. Some frequently asked questions. I'll read the question on here, and then I'll give a brief of the answer, because again, I'm trying to wrap this up, or I'm trying to make sure you guys get out of here in a respectful time. So me was a multiple employer welfare arrangement. We currently have Anthem, Blue Cross, and Blue Shield. Will our employees have to change their doctors? No, it's the exact same plan. You can move from Anthem to Anthem. So Anthem with small group has 3 segments. They've got the grandfathered plans that were put into place before the Affordable Care Act. Those groups can move from that to the Anthem SOCA. We also have the Affordable Care Act plans. They're community rated. If a company's with that and they go through the underwriting process, they can be put into the Anthem SOCA plan as well. And the network's the exact same, the Blue Access PPO. How will annual renewal increases be determined? That's a really great question. That's a big difference. It's almost the same process that we had before the Affordable Care Act. It is based on utilization and predictive risk. So unfortunately, if you have a really bad year, and the underwriters think that you're going to have a bad year, that's what we call predictive risk. If you've had claims for something that might indicate you need a future surgery, or you've developed a chronic condition or something like that, they determine the renewal increases on that. That's my job as a broker, is to negotiate those down. We're pretty good at it. I will tell you, this year we've gotten some big increases, but we go to market. There's a process called Form Fire, where we shop with other carriers. The big goal of shopping isn't to move you out of this plan; it's to negotiate with the incumbent, which in most cases is Anthem, which we're pretty good at. So renewals based on utilization, but it's not always final. So we, as a broker, that's our job, is to shop that. Do businesses need to meet certain participation, contribution requirements? Yes, you do, but it's a lot less strict than the traditional rules. So with the Anthem SOCA plan, 75% of net eligible employees must be on the plan. So what that means is we remove creditable waivers. So if someone has insurance through a spouse, through Medicare, through the VA, through individual coverage, almost anything is considered a credible waiver. The only people that count against that 75% are those without health insurance. You would hope that number is low. The traditional rules say you need at least 50% of total employees, regardless of credible waivers. So they are a lot less strict on that. I've got some clients with the Anthem plan. They may have 20 total employees and 2 or 3 or 4 on the plan because of that kind of a new participation requirement. And then it says, can businesses join the SOCA benefit plan anytime throughout the year? That answer is yes. There's no open enrollment period for this group plan. This goes over the effective dates that are available. I'm not going to go over those, but if you end up getting a quote, I can explain how that works. But the bottom line is, yes, any month you have to have the paperwork submitted by the 15th of the prior month, and it can be effective the upcoming month. And then, are there dental, vision, life, disability options? Yes, there are. It's the same concept. They sort of pull together on the back end. So the rates are very competitive, especially on the vision. The dental rates and life rates are good. There's not a huge fluctuation. I mean, it's right on par with everything else, but I have noticed the vision plans are very competitive. It also usually gives you a couple points off your health costs. So it's good to bundle those. Thank you. That's all I've got.